Clonazepam is a medication that belongs to a class of drugs called benzodiazepines. Benzodiazepines are known for their calming and anti-seizure effects. Clonazepam is available in tablet form and is taken orally, usually once, twice, or 3 times a day, as directed by your doctor. This medication is commonly prescribed to treat seizure disorders, also known as epilepsy. It helps to control and reduce the frequency of seizures by calming abnormal electrical activity in the brain. Clonazepam is also effective in treating panic disorder, a type of anxiety disorder characterized by sudden and intense episodes of fear and discomfort. The calming effect of clonazepam can help individuals manage these panic attacks and reduce their severity. It's important to note that clonazepam is a prescription medication, meaning it should only be taken under the guidance and supervision of a healthcare professional. Self-treating with clonazepam can be dangerous and may lead to adverse effects. Clonazepam is a valuable tool in the management of various types of seizures. It is particularly effective in treating Lennox-Gastaut syndrome, a severe form of epilepsy that often begins in childhood. Lennox-Gastaut syndrome is characterized by multiple seizure types, including atonic seizures, tonic seizures, and atypical absence seizures. Clonazepam helps to control these seizures by decreasing the excitability of nerve cells in the brain. In addition to Lennox-Gastaut syndrome, clonazepam is also used to manage other seizure types, such as absence seizures and myoclonic seizures. Absence seizures are characterized by brief episodes of staring and loss of awareness, while myoclonic seizures involve sudden, brief muscle jerks. The dosage of clonazepam for seizure control varies depending on the individual's needs and response to the medication. It's crucial to work closely with a healthcare provider to determine the appropriate dosage and monitor for effectiveness and any potential side effects. Beyond its effectiveness in seizure management, clonazepam is also prescribed to treat anxiety disorders, particularly panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks, which are sudden episodes of intense fear accompanied by physical symptoms. These physical symptoms can include a racing heart, sweating, trembling, shortness of breath, chest pain, dizziness, nausea, and a feeling of impending doom. Clonazepam helps to alleviate these symptoms by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, or GABA, in the brain. GABA has inhibitory effects on nerve activity, meaning it slows down nerve impulses. By increasing GABA activity, clonazepam produces a calming effect on the brain, reducing anxiety and promoting relaxation. It's important to note that clonazepam is typically used for short-term management of panic disorder, as long-term use can lead to tolerance and dependence. Clonazepam belongs to a class of drugs known as benzodiazepines, which exert their effects by enhancing the activity of GABA, a neurotransmitter in the brain. Neurotransmitters are chemical messengers that facilitate communication between nerve cells. GABA is an inhibitory neurotransmitter, meaning it reduces the activity of nerve cells. When GABA binds to its receptors on nerve cells, it inhibits the transmission of nerve impulses, leading to a decrease in neuronal excitability. Clonazepam binds to specific sites on GABA receptors, known as benzodiazepine receptors. This binding enhances the effects of GABA, making it more effective in inhibiting nerve activity. By enhancing GABA's inhibitory effects, clonazepam suppresses abnormal electrical activity in the brain, which is responsible for seizures. It also reduces anxiety by calming overactive nerve circuits involved in the fear response. Section 5. The benefits of clonazepam. Relief from symptoms. Clonazepam provides significant benefits for seizure disorders and panic disorder. It controls seizures, improving quality of life and reducing injury risk. It allows greater confidence and independence. For panic disorder, it reduces panic attack intensity and frequency. Clonazepam also improves sleep and reduces muscle tension. Section 6. Navigating the side effects of clonazepam. While clonazepam is generally safe and effective when used as directed, it can cause side effects just like any medication. The most common side effects of clonazepam are drowsiness, dizziness, and unsteadiness, particularly when starting the medication or increasing the dosage. These side effects usually subside as the body adjusts to the medication. Other potential side effects include fatigue, muscle weakness, dry mouth, nausea, and changes in appetite. Less common but more serious side effects include confusion, memory problems, slurred speech, and difficulty breathing. If you experience any unusual or bothersome side effects while taking clonazepam, it's essential to contact your healthcare provider promptly. They can assess your symptoms, determine the cause, and make necessary adjustments to your treatment plan, such as adjusting the dosage or exploring alternative medications. Section 7. When clonazepam is not right for you. While clonazepam is a valuable medication for certain conditions, it's not suitable for everyone. Individuals with certain medical conditions should avoid using clonazepam, as it can worsen their condition or interact with other medications they are taking. For example, people with severe liver disease should not take clonazepam, as the liver is responsible for metabolizing the drug. Impaired liver function can lead to a buildup of clonazepam in the body, increasing the risk of side effects. Similarly, individuals with acute narrow-angle glaucoma, a condition that affects the eyes, should avoid clonazepam, as it can increase pressure within the eye, potentially damaging the optic nerve. People with a history of drug or alcohol abuse should also use clonazepam with extreme caution, as it can be habit-forming and may lead to dependence or addiction. Section 8. Using clonazepam safely. Precautions and guidelines. To ensure the safe and effective use of clonazepam, it's crucial to follow your healthcare provider's instructions carefully and adhere to the recommended dosage. Never take more or less of the medication than prescribed, and avoid abruptly stopping clonazepam without consulting your doctor. Abrupt discontinuation can lead to withdrawal symptoms, which can be uncomfortable and potentially dangerous. These symptoms may include anxiety, insomnia, tremors, seizures, and in severe cases, status epilepticus, a life-threatening condition characterized by prolonged seizures. If you need to stop taking clonazepam, your doctor will gradually taper down your dosage to minimize the risk of withdrawal symptoms. It's also essential to avoid alcohol consumption while taking clonazepam, as alcohol can enhance the sedative effects of the medication, leading to excessive drowsiness, impaired coordination, and other adverse effects. Section 9. Interactions to watch out for medications and more. Clonazepam can interact with other medications, including over-the-counter drugs and supplements. These interactions can alter the effectiveness of clonazepam or increase side effects. Inform your healthcare provider about all medications you are taking. Medications that can interact with clonazepam include opioids, muscle relaxants, and antihistamines. Section 10. Long-term use of clonazepam, dependence and withdrawal. While clonazepam is generally safe for short-term use, long-term use can lead to tolerance, dependence, and withdrawal symptoms upon discontinuation. Tolerance occurs when the body becomes accustomed to the effects of a medication, requiring higher doses to achieve the same therapeutic effect. Dependence refers to the body's physical dependence on a medication, leading to withdrawal symptoms when the medication is stopped. Withdrawal symptoms from clonazepam can be uncomfortable and may include anxiety, insomnia, tremors, seizures, and in severe cases, status epilepticus. To minimize the risk of dependence and withdrawal, clonazepam is typically prescribed at the lowest effective dose for the shortest possible duration. If long-term treatment is necessary, your healthcare provider will monitor you closely for any signs of tolerance or dependence and adjust your treatment plan accordingly. Section 11. Seeking professional guidance. Your doctor knows best. Clonazepam can be an effective medication for managing seizures and anxiety disorders when used appropriately and under the guidance of a healthcare professional. However, it's crucial to remember that clonazepam is a potent drug with potential side effects, interactions, and risks. Self-treating with clonazepam or altering your dosage without consulting your doctor can be dangerous and may lead to adverse effects. If you're experiencing seizures, anxiety, or any other health concerns, it's essential to seek professional medical advice. Your healthcare provider can properly diagnose your condition, determine the underlying cause, and recommend the most appropriate treatment plan for your individual needs. They can also discuss the risks and benefits of clonazepam, address any concerns you may have, and monitor your response to the medication.